James.
Just to deal with the last 2 points very quickly, I mean, what has been the rise in health spend in Ireland since 2006? Far in excess of that. That's the first point. The second point, Ashton quite rightly points out that we are not going to take the entire Dutch model and transpose it here. That was never the plan. We were always going to take elements of the Dutch multi-sure model to suit that end of what we were trying to achieve. The initiatives used in the north of Ireland to address the waiting list initiative, the UK trust model for hospitals, because many of our hospitals, as you point out here, actually are public hospitals, and we want to make them more autonomous and give local people greater say, and we want to use the Danish model in relation to Patient Safety Authority. I think it's important though to step back for a second here. I mean, our economy is in meltdown, our health is in chaos, and our international reputation is in tatters, and Fine Gael does have a 5-point plan to deal with this, and health reform is a key pillar of that. Now, you know, there's no point in saying that, as has been said,
can you do it for the same money?
Yes, we can. Pat, can I say this? When people say, God, you must be off your rocker, Reilly, to want to take health, I relish that opportunity and the challenge.
Mary Harney said that very same thing to me in this studio.
I'll tell you the difference between myself and Mary Harney. Among the myriad of obvious differences, there is one big difference. I intend to change it, and I know the money is there to do it, and I am utterly convinced with the experience I have had as a doctor working at the coalface for nearly 30 years in this service that the people are there. Barry, I didn't interrupt you now, so just let
him finish.
I am utterly convinced that we have the resources, that we have the people, but what we have lacked is the organisation, the managerial skill, and most importantly, the leadership. And what we intend to change in this is ministerial accountability, leading from the front, like they did in the north of Ireland with the waiting list initiative, making people accountable. My neck will be on the block, and those who work below me, if I'm lucky enough to be elected and put into health and Fine Gael in government, will be responsible to me.
So you're looking for good managers to run the hospitals efficiently, and Jerry Robinson's thesis is, and the NHS, the way to improve the NHS and make it work efficiently, he went in as a consultant, was to actually, you know, pay peanuts, get monkeys. So you got to pay the managers of the hospitals the kind of money that enables them to look the consultants in the eye and tell them what is required of them.
Well, the difficulty here is that we are not paying peanuts. We are paying large sums of money to hordes of administrators and managers, many of whom are good people, but never got the training to manage properly.
So what's going to happen to those people?
Niamh Brennan made the point.
Can't teach old dogs new tricks. What's going to happen to them?
Oh, yes, you can.
They're going to get redundant.
Sorry, Pat, I'm an old dog, and I learn new tricks every single day. And the day I go to bed at night without having learned something new it will be a bad day. I'd say it'll be the day that I'll be finished. So I don't accept that thesis at all. We have some of the best people in this country, but we need to bring in outside management. We need to retrain our existing managers, and we need to get this show on the road. And we will do it, and we can do it within the money that we have already. And that is the wonderful thing about health.
James, right.
Yes. I'm sorry, I have to challenge what Jan has said. We have well costed out our document, and we went through it yesterday with journalists, and there was no questions around it. But I'll tell you this much. There is 700 million identified of savings that have to come from health in Labour's document, and there's 500 million of committed spend between GP care and long-term care. That's 1.2 billion. Yet Labour only identify in their document 700 million in savings. So there's a black hole of 500 million, Jan, that you're going to have to find in order to deliver free GP care by 2014. And that is why Fine Gael have not gone there, because we are not going to make promises we can't keep, and we are not going to promise to spend money that we haven't got. And can I just make the other point about the HSE Mark II being in charge of insurance along with the VHI? I can't think of a worse nightmare. What will happen there then is 80% of the market will be controlled by the state, effectively pushing out any other competition, and people will be left with no choice other than the VHI and HSE, both run by the state, both offering very little between them, I am